Good morning. It is August 30th. Welcome into the Morning Medical Update. Today, we are so glad to welcome back in Dr. Angela Myers. She is the Infectious Disease Division Director at Children's Mercy. She's going to help us sort through some of that information out there regarding our kids, the vaccine, all sorts of good stuff. So we're glad to have her. We're also going to hear from this mom. She, like so many parents, sent their little kid off to school, but last week, her 4-year-old turned up COVID positive. It's been a roller coaster of emotions, as you can imagine, for their family just in a matter of days. But we're going to talk with her, and we're going to find out how little Hazel is doing this morning. But first, let's get our numbers. Let's see what has changed over the weekend. Doc Hawk, good morning to you.
Hi.
Hi.
Good morning.
Good morning.
Yeah, I mean, I think the weekend, I'd like to be optimistic here. Over the weekend, we did see a little bit of a decrease in our hospitalizations. I think we were in the low 30s on Friday, low 60s on Friday. Right now we have 58 active infections with 25 in the ICU, 13 of those on the ventilator, and a 38 still in that recovery period, so a total of 96. We did have a death on Saturday as well. So Hayes has 12 active infections as well. So their numbers are holding steady also.
Okay, thanks for your update. Okay, we want to talk about blood donations this morning first before we get to questions. So we need your help. Hospital cases are up and the blood donations are way down. Our local blood shortage is at an emergent level as fears over COVID lead to a drop in donations. So right now there is about a 2 to 3 day supply, but that is actually very low. There's usually about a 7-day supply. This is incredibly concerning for emergency rooms. This is where we need your help and you to step in. Donating blood is safe, and it only takes about an hour. The Community Blood Center is taking extra precautions to prevent the spread of COVID, as they really have throughout this entire pandemic. So you can schedule an appointment or learn more about hosting a blood drive. Just call 1-877-468-6844. There's the information on your screen. You can also visit savealifenow.org. Okay, let's get to our reporter questions. Do we have any on the line this morning? Okay, I have a couple, and I'm going to start with Dr. Myers first. Okay, so KCTV5 has a question about Hurricane Ida and the impact that it could have on patients in hospitals. Potentially, they could be without power for 3 weeks. What are hospitals supposed to do there? You have some insight, because you remember this time, 15, 16 years ago when
so hospitals are a little bit better prepared now than they were during the Katrina hurricane. They've moved their generators up from the basement, so they're not going to be flooded, and should hopefully continue to work and provide some power to the hospitals. I know they're also a little bit better prepared in terms of food stockpiling as well for all the healthcare workers that need to stay there 24/7 and really can't go home right now.
Well, you think of all the all the challenges anyway during a pandemic, and now they're facing those challenges they faced so many years ago with this on top of it. I can't imagine what those folks are going through.
I can't either. It's a terrible situation, and my heart goes out to them.
All right, thank you for that. I have another question, though, and I think I'm going to direct this towards Dr. Hawkinson. This is from Jason at the Topeka Capital-Journal. And can you just take us back to the last flu season and how it was different from normal, and then look forward at what you predict this flu season will be like? That's the first part of the question.
Last flu season, we didn't really see hardly any flu. There was a little bit of an uptick, if you remember, early on. Before the pandemic came to the United States, we were having some flu activity, but again, that was late February, early March. Once that happened, we did expect to see influenza and COVID co-infection, but we really didn't see that. And since that time, the influenza activity really remained low. We saw that these past now 2 flu seasons in the southern hemisphere, and most notably Australia, they still have very little activity. It's really going to be hard to predict what's happening. Again, as we've talked about, there are such different restrictions, mandates, issues going on with every different country. We know that here in the United States, really, there isn't a lot of masking that is going on. Some areas, geographic regions, do have some mandates. Others do not. I think it will be interesting to see what does happen this year once we all go back inside. When it gets colder, we aren't able to do things outdoors anymore. And if there is really no masking, or if some of those restrictions are lifted, it would be interesting to see what is happening. I would expect we would have more influenza activity this year, this influenza season than we did last year, mainly because of that, mainly because of any lifting on restrictions or mask mandates at that time.
Jason also wants to know, will there be any combo booster flu shots, or will people just be getting them at the same time?
Yeah.
What's that going to look like?
Yeah, I mean, right now, as far as production goes, the majority of the influenza vaccines are made a certain way, and they have been for decades on end. That will continue. We obviously know that for the COVID vaccinations, there's either the adenovirus vector, which is the Johnson & Johnson, or the mRNAs. Right now, there is no platform for that for influenza. We know that is being researched. So at this point in time, you are likely going to be getting 2 separate injections. Now, do you need to do it at the same time? You certainly can if you're there and you have the ability to get dosed with those, because we don't want to miss an opportunity to vaccinate, but also we still are going to be waiting for some guidance for further or additional dosing of the COVID vaccines. So, but either way, you can get either both of them at the same time, or depending on what your schedule would be, if there is additional dosing that is recommended for the COVID vaccines, you can do it separated if it meets your schedule.
Well, we know our community is going to have questions for Dr. Hawkinson and Dr. Myers, so get those in. But I do want to introduce our guest. Again, reintroduce Dr. Myers. Happy to have her here with us today. Joining us virtually also is this mom. This is Jenna Sutter Brown. Her daughter was recently diagnosed with COVID and is on the mend this morning. We've seen her kind of jumping around behind you there, so that's good news. Jenna, we're going to get to your story here in just a moment, but how is Hazel feeling this morning?
Doing a lot better. Being able to get sleep at night has been a game changer. The first night she was able to sleep through the night, she woke up and bounded out of the room and said, "I feel better." So every day just gets a little bit better. Her appetite's coming back. An occasional cough here and there, and not quite as energetic as usual, but she's more herself every day.
Very good. And she's just 4 years old. So we're going to hear about your story here in just a moment. So stay put. But Dr. Myers, last time you joined us, Mercy had 15 positive COVID patients. How many now? What can you update us on?
We have 11 right now in the hospital this morning and 3 in the ICU.
What is that telling us? What insight do you have on what
So
that tells us?
It's a little bit lower than what it had been when we peaked at 22. We over the last week kind of had stayed steady between 15 and 20, and this may be a trend that we're coming down below that. We'll just have to see over this next week.
Is there a typical pediatric COVID patient? I mean, as far as severity or age, or does it just vary? What can you tell us?
It does vary. We've seen it in all ages, from newborns all the way to 18 plus. We have kids that get admitted to the hospital who have underlying conditions, but also kids that are otherwise healthy with really no huge risk factors other than asthma, or they may be obese, which is pretty, both of those are pretty common these days. So it's not just kids with immune deficiencies or being, organ transplants or being treated for cancer who are getting admitted to the hospital.
Yeah, that's a question we get a lot. I think a lot of parents assume that if they're in the hospital, they have some sort of other pre-existing condition, and that's just simply not the case always.
That's correct.
Maybe more often. Okay, so we got to talk about schools. And in Wichita, they're closing down. Schools in the Wellington School District closed until September 7th. The superintendent says that there were at least 40 COVID cases in the first 8 days of school. Masks were recommended if unvaccinated, but not required. Is this something that you think we're going to see more of across the metro? And I know we already have.
Yeah, so we already have. Turner School District had 23 cases in students and 4 in staff in the first week of school, which caused them to change their masking policy to requirement. Some other school districts have seen cases as well, and I think are revisiting some of their policies because of it.
And you're a parent. I mean, what concerns you about this season versus last school season, this time as we open schools up?
Well, last school season, there was not a question. If kids were in school, they were masked, right? There was also a lot of hybrid and different things happening. So, I think people were just, in general, more careful than they kind of are this time around. And unfortunately, we also have a more contagious virus at this time. So people are somewhat being less careful, and we've got a more contagious virus happening.
Right. We're leaving options up to parents. instead of health professionals. That's not always a good thing, right?
That's not always a good thing.
That's not. I know. And parents have the best intentions in mind for their kids, but just right now it's a tough one. Okay, so help us with this one. Kids are back in school. How should a parent or a caregiver handle an exposure if their kid is positive? How do they know? Who do they make aware? It just seems like not everybody's in check, again, the way they were last year, where I feel like there were more things in place. And I think Jenna's going to talk a little bit about that too. You know, how do I know to go to my doctor or to go to the school, and who's kind of keeping track?
Sure. So, some of the schools are doing testing in the schools. So in that case, it makes it easy because the school already knows if your child's positive. But if not, and you're going to your doctor's office and getting tested there, or you're going to an urgent care, then once you get your result, you really do need to notify the school. You need to let them know your child's positive. You should also be notified by the health department because every positive case gets reported to the health department. Mm-hmm. And then you need to follow the guidelines of your school for home isolation until your child's symptoms are better, fever-free for 24 hours, and the length of time that they want you to be home, which is typically 10 days.
So really nothing's changed.
No.
It's just being aware.
Yep.
I want to bring in Jenna and get to her story. Anything else you want us to know before anything else you need to update us on?
I don't think so.
Okay, we got some questions coming in for you. Already have some from last week, so they missed you while you were gone. So, okay, so Jenna, just how did you come to discover that Hazel had COVID?
So symptoms hit pretty suddenly on a Sunday night as she was going to bed, and they mimicked allergies. And so we hit her with an extra dose of allergy meds, put her to bed. But then about an hour and a half after she woke up, or had gone to sleep rather, she woke up and I just knew she had a fever. And so I kind of made the call overnight that we were going to be going to the doctor because she'd been home the entire pandemic and we'd mitigated risk the entire pandemic, and she had just gone back to school. And so for me, it was, this is either a typical back to school virus, but not getting tested wasn't a choice. And so that was the first thing on my mind when we woke up.
Well, Dr. Myers, a fever, sniffles, runny nose on a 4-year-old. I mean, how would one know?
Well, fair point. But what we know right now is that coronavirus is really circulating, right? The Delta variant, it's very contagious. RSV is also circulating, and so are some other respiratory viruses. So if you have respiratory symptoms, you need to get tested. Bottom line.
And listen, are you supposed to be listening to their chest, their breathing? What would differentiate that?
As a parent, things you might want to look at are how fast they're breathing. You can count, you can use the second hand on your watch and count for a full minute, see how many breaths they have per minute. You can look and see if they're sucking in at the base of their neck or in between their ribs. Those kinds of things are concerning. You should be going to get seen right away or going to an ER if your child is really struggling to breathe or breathing really fast. But, in reality, the rest of this is fever. About 50% of kids are going to have fever with COVID-19, but a lot of them have sore throat, runny nose, congestion, all of the other things, and they can be very mild. So don't be complacent. If they have symptoms, get them tested.
All right, so Jenna, keep going. Tell us what happened. You go to the doctor.
So we went in, and strep was the first thing they tested for. And then the nurse practitioner we saw in particular said that most of her cases were gastrointestinal. So she wasn't convinced it was COVID, but did the test anyway because we were there and I requested it. And then I was told it would take 24 to 48 hours because there is a shortage of a piece of equipment that would allow them to test in office, but they don't have that piece of equipment, so they had to send it out. And I clarified with her just that, if Hazel's fever had gone away between the time she was tested and the test came back, did I need to keep her home from school? And I was advised no, which really surprised me, knowing that I could send her to an unmasked preschool facility with an outstanding COVID test. And thankfully, we kind of went against that judgment and kept her back, or I would have been calling the school, telling them that my daughter was positive for COVID instead of calling my husband at home with her. So,
Dr. Hawkinson, I mean, what advice? Because I think, you get a parent to actually take their kid in, and then you have a doctor saying, I don't think it's that, but then you have a mom's instinct saying, oh, but I think it could be, and I just want to rule it out. What do you think?
Yeah, I mean, I think it's kind of frustrating. Just like Dr. Meyer said, we know that there is there is a very high prevalence of coronavirus going around right now in the population. Pediatric population, adult population, going to get tested, you should wait for that result because that there is a high probability it is that. It is unfortunate to hear some providers say, well, I don't think it is, or maybe we don't want to test. That is, again, just not keeping up with the actual community spread, the infection dynamics around our geographic region here. So that was very astute to keep her home. Typically for respiratory viruses, we say your child can go back to school after about 24 hours of being fever-free, and please correct me if I'm wrong. But, this was very astute by our guest to be able to keep her home until that test came back. So it is very important. I think we need to do more testing. I think there's probably a lot of strep throat testing going around when people are having fever and cough and rhinorrhea or runny nose. It's typically not the symptoms of strep throat, but yet when you have coronavirus going around and you know it and you don't want to test for it, that's just just a lack of really understanding what is going on, what are the infection dynamics in our particular area.
And we have the testing available. I think when it first started, people were, okay, do I get tested, do I not? It wasn't maybe as convenient or readily available. Now it is. And with Delta, should we just be going just to be better safe than sorry? Is that the advice to parents with kids and runny noses?
Absolutely. It's way better to be safe than sorry and just get tested. And gastrointestinal symptoms like diarrhea and abdominal pain are features of COVID-19 as well. But so are all the respiratory symptoms. So it's not, you can have one or the other, or you can have both. And so there's really a wide range of symptoms. So you should test based on any of the symptoms that are possible for COVID-19. There are some people that only have loss of taste and smell. They need a test.
And I know Jenna had a question for you, and I'm going to ask it if you don't mind, Jenna. But the question was, if I'm a parent and I go in and my doctor says, oh, I don't think that's what it is, you don't need it, should I push back and say, no, I want it?
Absolutely. You're the best advocate for your kid, and you know your kid the best, right? Nobody knows your kid as well as you do. So if you go in and you are concerned that your child has symptoms, then I would request a test and have that conversation of why you think it's important. It's important for your child. It's important to know if they're infected because it changes maybe the things you do in your home with your family and the precautions you're going to take to try to keep mitigation of the infection within your home. But also it's important because it's a public health issue, and you need to tell the people your child's been around in their school and any other family and friends they've been around.
So, Jenna, I have to say you've handled this really well. I had a chance to speak with you, and you're just so calm, and you handled everything right, and you just asked all the right questions. I imagine myself, Dr. Myers, like bouncing off the walls, going crazy, not being able to think straight if my kid had COVID. So I appreciate, Jenna, you being like a really good voice of reason about just keeping calm. Kids absorb what you put out, so, handling your business, and I appreciate that. But what was the scariest moment for you? There had to have been a moment that was like, wow.
Really, I think the moment where my husband and I each kind of had to bring ourselves back down was the night before we got the diagnosis. Was the first night that all of her really bad congestion kind of came to a head, and she woke up, kind of with that barking cough, and I try hard to listen to her and give her the chance to tell me what is wrong. And so I said, what's wrong? Does anything hurt? And she just looked at me sobbing and said, I don't know. And that's never happened. And so, again, that's the night before she was diagnosed. But that was one of those, do I need to call 911? Is she breathing enough? But really, it was just pausing in the moment and reminding myself that the more amped up I got, the more she was going to ramp up and have a difficult time coming back down. And obviously the phone call, we were talking yesterday how it just felt like a movie. After trying so hard for 18 months to keep this virus away from her and being so close to a pediatric vaccine, that was a sucker punch that we were not really prepared for. And that, I think my husband and I both went through a quite broad range of emotions after finding out.
And you said you're just going to go back business as usual, making sure that you're masking, basically doing everything you've done since the beginning of the pandemic.
My husband is immunocompromised. I work around people who can't necessarily mask fully. My parents are older and very much involved in our lives. And to us, it's just our responsibility. We never really stopped taking those, mitigation opportunities. We talked a little yesterday about how briefly over the summer when the numbers got really low, we ate inside maybe 2 times, but for us, those things just aren't worth it. But I have a really great masker, and she does a great job, and I'm going to keep capitalizing on that just because, I'm not naive. There are false positives, and maybe she didn't have it. And so I'm going to treat it as such, that we still owe our community. And, also it's a lesson in authority. This is what you're being asked to do. It's not blind obedience, but it's the best for your community. And I want to instill that in my daughter as well.
Fantastic. And it's good to know you and your husband are both vaccinated. And what does it say, Dr.
Double doses of Pfizer, yeah.
Dr. Hawkinson, what does it say, though, that you're living under the same roof with a small child, obviously hugging and kissing and coughing and snuggling, and you're both vaccinated? She's now negative. Jenna tested negative. But does that say something about the efficacy of the vaccine?
Again, the vaccine isn't really to protect against infection. We do know that household rates can range anywhere, depending on what study, from 15% to 50% of the rest of the household infected. I think it's just difficult to say. But the vaccine, if they would have gotten it, the vaccine continues to provide that protection against the whole spectrum of disease, meaning the whole spectrum of symptoms. So whereas you may have had a week of not feeling good or something of that nature with cough and fevers and body aches, it could be reduced down to 2 days and you may just have a sniffle. The vaccines continue to protect against the more severe disease, such as going to the hospital and going to the ICU and things like that. So I think the vaccines continue to work, and it just is, sometimes it is dumb luck, and we have seen that with those studies when they look at household attack rates when one person has it. But what they did see is that households where children were infected did seem to cause less attack rates in the household compared to when those adults in the house were affected. They seemed to have higher attack rates as well.
Yeah, Jenna, I think you were saying that if you did come up positive, because you were waiting for a pending test last night, which did come back negative, that if you would hope that this would be the worst that you have seen of it, some of your mild symptoms that you had. So that's good. So I know you have a quick question that you wanted to ask Dr. Myers. Is Hazel close by? Is she going to come say hi to us real quick?
She is. She's actually right next to me. Do you want to come say hi? Come here. Everybody wants to see that you're doing well.
Hi.
We're still in our jammies, but
Hi. How are you?
Good.
Are you feeling better?
Yeah.
Yeah, awesome. Well, we love to see your face, and we're so glad you're doing better. You're going to get better, and you're going to get back to school, okay? And you're going to keep wearing your mask?
Right?
Her name's Miss Alicia.
Yeah, you're excited to go back to school.
She looks great. She's so precious, and thank you for sharing her with us.
Yes, thank you.
And I know you have a question real quick before we get to our community questions for Dr. Myers. You had a question about antibodies and getting the vaccine when it is available for those 11 and under.
Yeah, absolutely. I'm aware that if adults had corona, they were supposed to wait a certain amount of time. We were going to be the first in line to get her vaccinated once they were approved, but I'm just curious if this kind of changes our timeline and if we should hold off for a while, or what kind of that antibody buildup looks like in a child as young as her.
Yeah, sure. That's a great question. So, what the CDC kind of came out with was that for adults who had coronavirus who got monoclonal antibody, they needed to wait 90 days to get the vaccine. So 3 months later, get the vaccine because you're getting antibodies during the infection. But if you've had disease and you didn't get monoclonal antibodies, just the infection itself, then you really only have to wait until you get out of isolation, so 10 days. So as soon as she's out of isolation, and as soon as we get the vaccine for young children, she is eligible, and I would get it as soon as possible. We know that the antibodies that you develop from vaccine are really great, and that people who get vaccine post-infection have a huge immune response, which is really wonderful. And they develop something called neutralizing antibodies, which are the type of antibodies that actually kill viruses. So there's different types of antibodies that your body makes, and some are non-neutralizing and then some are neutralizing, and the vaccine helps you produce more of those neutralizing antibodies. So they're more effective, if you will.
Hey, Jenna, stick around because I know our community is going to have some questions for you as well. So, but Dr. Hawkinson, I have a question from Samantha. She says she has a colonoscopy scheduled in late September, but she's concerned about maybe complications. Should she reschedule the procedure right now just in case there's a complication and she might have to end up in the hospital? And we know there's a lack of beds and staff. What would your recommendation be?
I would talk with that team that is going to be performing the procedure at whatever facility you're at. But right now, I would say no, that's probably not needed. I think it's more important to get that screening done. We know that during the procedure and pre-procedure, all of those safety protocols are going to be taken in place to help stop spread of coronavirus within that facility. But then again, we are also seeing a lot of stories over this past year that people haven't been able to get their screening done for cancers, from cancers that are easily detectable. So I would say go ahead and continue to have that scheduled procedure done. Yeah,
it's going to be really hard to hear one of our doctors say to put off a screening, right? Yeah. Just too important. Okay, so we're going to get to community questions, a lot of good ones today. So let me start with this one. This is from Kathy, talking about preschool masking. She says in Southwest Missouri, no daycares mask. I know a lot do here in our area as well. She doesn't get it. Why aren't preschools where you see four-year-old and under not masking? Why do you think that is? We know they can do it.
Yeah, I don't know why that is. I know that there are some areas of our country that have just been more resistant to masking in general. We've seen what happens when kids are together in groups, whether it's preschool or it is regular school, and they're unmasked. So, hopefully some of these places will change their minds and start having all kids mask as they see more and more cases happening.
Well, you see like on airplanes, if you're two and up, you got to wear one, and kids can do it. So for several hours. Is the J&J, Nancy wants to know, is the J&J shot being assessed for children? We know.
Not to my knowledge right now. I'm not aware of any vaccine trials in children.
Michelle wants to know, what do you do if you find out that a child was exposed 8 days ago? Find out from your child's school that your child was exposed 8 days ago. What would you do?
Okay, so first, what does the school say? Was it a true exposure? Were both kids masked? Some health departments aren't considering that an exposure, which would mean that you would need to quarantine, and kind of, so what's the situation there? And then, if it's 8 days after your exposure, you're already close to that time frame where you would be showing symptoms if you were infected. So one of the things you could do is the CDC recommends testing post-exposure, just to make sure that you don't have an asymptomatic infection before you would return to school. But the other thing you need to do is find out what the school policy is and what your local health department is. So if it's that you can return to school after 7 days, then if you're at 8, you're already beyond that time and you can go back with a negative test. For some it's 10 days out with no test. I know that in some schools they're allowing kids to stay in school masked, but they're testing them every day. So it really depends on what your school has decided to do and what your local health department also says.
But 8 days is a pretty late notification.
It's a really late notification, and that it's surprising. So you wonder kind of if they had trouble locating all of the people that were contacts, or if they got a late notification of the positive test. That's also possible.
Anne wants to know, will ages 5 to 11 get EUA for vaccine, or will parents have to wait for the FDA approval for this age group to get the shot?
Yeah, that's a great question. I don't know the answer to that. My hope is that they will be able to just approve it flat out without the whole EUA step, because obviously there are some people that provides reassurance for, and that's completely understandable. But I think the most important thing is that we get it as soon as possible so that we can get as many kids vaccinated as possible.
All right, Dr. Hawkinson, you're up with a couple here. Tara says, is it still considered safe for children too young to be vaccinated to play outdoors together? Should we still be trying to keep them 6 feet apart?
Mm-hmm. I think it's pretty hard to keep kids apart. But again, I think outdoors is much safer. And then it gets down to the individual groups and the bubble and the children that are playing together. Do they have any known exposures or infections? But overall, playing outdoors and doing that stuff and letting kids get out is going to be pretty safe.
Okay, Stacy wants to know, how can we feel safe sending our unvaccinated kids to school who are, under 12? We have a mask mandate, but lunch and exemptions and kids wearing their masks wrong, she says her anxiety is through the roof. We feel ya.
We do feel ya. Hopefully kids are being helped with wearing their mask appropriately by the teachers, by the school staff and administrators, and hopefully by other kids. Hopefully other kids feel confident enough to say, hey, you need to pull your mask up. In places where they have kind of lunch spread out, so 3 feet or more distance is helpful, because obviously kids aren't masked during the time they're eating lunch, and also kind of same seat lunch so that who's been where every single day is incredibly helpful. And then of course outside, if you're able to, is always a good place to eat lunch. I realize that that's not going to be really workable for very much longer here, but those are all good mitigation strategies.
Yeah, they line my kids up outside, all facing the same way, spaced out. But how long can you do that here in the Midwest? At least during these warm days, let's try to get some of those outside meals in. But Dr. Hawkinson, clear this up for Isaac. What do you make of a recent study that said immunity from natural infection was more durable than vaccine?
Yeah, there's a couple. So this is a big question that has arisen and has been around since the vaccines came out. There are a couple studies now, mostly I know in preprint, that are looking at that and have shown. I don't know again that it's more durable. But also they are looking at and asking the question, does it provide better protection against infection? I think there's a preprint out of Israel that may show that, but I think there are a lot of caveats to that study as well. And again, like I said, the purpose of the vaccine is not protect against infection. It is to protect against that whole spectrum of disease, especially that more severe disease that lands you in the hospital. So it looks like it does do that. We do have good cellular data from some of the basic research showing that those people that got vaccinated, even with 1 dose after natural infection, seem to have, number one, higher levels of antibodies, again, for what that means, but also that the evolution of those B cells and the creation of those antibodies seems to be a little bit better in those people that have received vaccine versus those people that have received or just had the natural infection, especially if it was very mild infection. So I think we are also starting to see a little bit that on the T cell side as well. Just the evolving of that immune response due to the vaccine seems to be a little bit better than with natural infection alone. But that is a very good question. That question is being asked, and hopefully we'll get more information about it, especially in those people that may have had natural infection prior to Delta. And now with Delta variant going around and being spread so much, we can compare those two groups of people as well.
Hey, Jenna. Donna has a question for you. She wants to know if you know where Hazel contracted it. Do you know how she was exposed or where she was exposed?
I mean, obviously adding, my husband and I both going back to work and her seeing the vaccinated adults in her life also go back to work. We can't rule out that it wasn't one of us potentially bringing it home, but our gut says school, because again, that's the only indoor location she's been unmasked literally this entire time. So I don't know if we'll ever know 100%, but to me, that is the biggest variant that was in the equation.
Yeah, it's hard not to rule out school, that's for sure. Ardith has a question, and I'm going to read the whole question because I want to make sure I have all the details right. My daughter was sick last week, tested for strep, RSV, and COVID. All 3 were negative. Both kids have been off school since last Tuesday. Yesterday, her brother started vomiting and had a fever. We plan to take him to get tested today because I was told there is a chance my daughter had a false negative. How common are false negatives?
Well, that really depends on the type of test you're using. So it's pretty rare to have a false negative test with a PCR, because remember, a PCR test is looking for the actual genes of the virus itself. And when you have COVID-19, especially within that first few days to a week of illness, you're shedding just tons of the virus. So it should pick it up. If you're doing an antigen test, which is just looking for a protein on the surface of the virus, that is not as accurate. Those are not as sensitive nor are as specific. So it's possible to get a false negative with an antigen test, but it's pretty unlikely with a PCR.
Okay, Shannon says, my kids are in a district where masks are not mandated. School board listening to non-believers and anti-maskers. What can we do to make these people realize that it goes beyond their personal feelings and masking and doing what is best for our children? Both docs weigh in on that one. Yeah. Who wants to go first?
Oh goodness! So this has become such a hot button issue, and it can be hard to have conversations with people, and it can. I mean, because it causes like almost a visceral or an emotional reaction, and so I would like to say that you can have a constructive conversation where you can talk about the data and how masking does prevent transmission from person to person, and how in so many places this has been shown in different environments, from hair salons to airplanes to Navy ships. I mean, all over the place this has been shown, and in schools. But sometimes that isn't what works for people. And so understanding their values and what it is that makes them so resistant may be helpful, and may help you get a little bit further into the conversation before a wall is put up.
Dr. Hawkinson.
Yeah, I mean, I agree. I think it really has become not about the medicine so much as the political, emotional issues surrounding this for one reason or another. And I think it's just continuing to have those conversations as much as possible. And also look at what is going on when that happens. Are these schools able to continue to move on and carry on without the mask mandate? Certainly, or without masking? Certainly, from the available peer-reviewed, consistent evidence, that answer would be no. And a lot of these schools are being shut down now and quarantined. And again, that puts kids at home. That increases isolation. So I think it's just a matter of some people really have to see the changes and the results for themselves. Unfortunately, it will lead to further spread of disease in those kids, but also in those that community and those household members as well.
Hey, Jenna, Nancy has a question. She says, if you think that Hazel may have gotten it from school, do you know if any other kids showed up positive, or were those kids sent to go get tested as well? What was the process there?
So we reached out immediately, obviously, to her school and let them know. And I do know that the provider reached out to me that evening just with some questions, I'm assuming from other parents in the group, about things that were happening with their kids. And, I really just said, go get tested. And I let them know, I let her know to pass along that it wasn't the first thing that my doctor offered and to ask for it. And so she really did just check in this time we've been talking and said, I asked, hopefully that everybody was well. And she said there was a few GI issues, but anybody who had problems this week got tested and was negative. So
that is good news. Dr. Myers, Chelsea has a question, and I know several people like to get this update on when the timeline, or what the timeline is going to look like for kids 11 and under getting the vaccine available to them. What does that look like today?
Oh, I wish I had a great answer for you, and I had a crystal ball that could tell me. I think it's going to be later this fall. Exactly when that is, I'm not sure. It took longer than I think was originally thought because of doing the dose finding studies and really figuring out what the best dose is for those youngest children all the way up through 11. And I suspect that there will be maybe even a different dose for some of the teenagers as well, later.
I'm going to try to squeeze in a few more questions. Jacqueline wants to know, she says, my daughter's kindergarten teacher told parents that kids were leaving their masks on their desk when they head outdoors for recess. It's just a quick walk outside, only past a few classrooms and straight outdoors. But the reasoning is that this is less than a 15-minute unmasked exposure. There's 20 kindergartners. They're doing this 2 to 3 times a day. Is this safe?
So I would keep the masks on until you get to the outside. Remember it's 15 minutes cumulative over a 24-hour period of time. So I would err on the side of caution and just have the kids keep them on until they actually get outside. To me, that's the safest thing to do.
Dr. Hawkinson, anything to add?
Yeah, I would agree. I mean, I think it's just, we don't want to be splitting too many hairs here, but I think it is important to continue just that consistent way of doing that.
Yeah, I think it's just because schools have so many different rules and what's good for one school, not doing the same, different than last year when everyone was on the same page. So Wanda wants to know, if you just recovered from having COVID and were unvaccinated, do you need to be vaccinated? And if yes, how long do you wait to get vaccinated due to having those antibodies?
Yeah, well, I mean, the main guidance is that there is no minimum time between infection and vaccination. So once that 10 days is up, where you should be isolated at home so as to not spread it to other people in the community, you can go ahead and get vaccinated. So, you can do it at any point. It is certainly reasonable. And again, remember, when you get that first vaccine dose, that will also help to boost that adaptive immune system, boost those specific B cell and T cell responses, so that will be a good thing. But overall, there really is no minimum time to wait from infection to getting vaccinated.
Okay, last question is from Sherry. What is the efficacy rate for 12 to 16-year-olds on the Pfizer vaccine? The trials said 100%. Is this the case against the Delta variant?
I think the trials were looking, and I have to go back and look at the data, but I think they were looking at symptomatic disease. So again, I think when we talk about vaccine efficacy, we have to understand, what are we asking in efficacy? Is it just becoming PCR positive? Is it just symptomatic disease, any disease, or is it hospitalization? And we know that these vaccines continue to have very good efficacy against protecting people from going to the hospital, going into the ICU and dying. And that is really the main goal here. If we can save further significant disease and lives, that is the purpose of the vaccine. The vaccine continues to do that even against Delta variant, and multiple studies have shown that from Scotland, from Israel, here in the United States. It continues, the vaccines continue to protect people against those types of infections and disease, which is the important thing. As far as what is the efficacy for that for adolescents, it continues to be very high as well. But I don't know if there's any large-scale data necessarily about that as far as that specific age group goes right now.
Okay, nope, I have one more. Melissa wants to know, if your child just has a tummy ache that keeps them home, so they have a tummy ache that makes them want to stay home from school, should they get a test?
I would look carefully at any other symptoms just to see, do they have abdominal pain and diarrhea? Do they have abdominal pain and congestion or something else? If it's a tummy ache and they've eaten something that didn't agree with them or what have you, and it passes pretty quickly, it's probably not COVID-19, but I would really carefully think about all the other symptoms and talk about it with your child before I would make the decision not to go get seen and not to get tested. I would always err on the side of caution there.
All right, and one last one, because people ask questions that I want to know too. So Melody says, how many deaths in kids from COVID vaccine? Just kind of how rare is it? What are we seeing? What kind of trends are out there?
Yeah, nationally, there's been more than 450 deaths since the beginning of the pandemic of March of 2020. So
from COVID or the vaccine? Did you ask?
From COVID.
From COVID, yes.
Yeah, from COVID-19. That's more than what we would typically see from influenza. So, a lot of people have come back to me and said things like, well, but this isn't a very bad disease in kids, and kids don't get very sick, and this is like influenza. That's not true, right? So when in a typical influenza season, we have between 100 and 150 kids pass away in our country from influenza. So we've had 450 kids in the last 18 months die from COVID-19. So it's quite a bit more than we would generally see through 2 influenza seasons. So it isn't the same. It is more serious, and it can be deadly. So I don't want people to become complacent now about this virus. This is still very widespread in our community and is far more contagious than the previous versions of of the infection.
Yeah, we don't want one.
And the long-term effects too, even for young children, is important.
Do we know what those could be? Are they the same as adults long-term?
They are. They don't happen as often, as they do for adults, but there are definitely proportions of children who have long-term effects from COVID just the way adults do, 6 months out or even a year out from infection. In addition to that, remember the multi-system inflammatory syndrome of children, or MIS-C, that children can get following infection that could be very, very mild. I mean, we're talking just a sniffle and maybe a day or two of sore throat, and then develop MIS-C 4 to 6 weeks later. And you don't know who that's going to happen to, and that's scary for parents. I mean, it's a highly inflammatory condition that lands you in the hospital, and oftentimes with some heart dysfunction.
My last question is for you. When are you coming back?
I don't know, whenever you have me.
All right. We're going to get you on the books. Don't worry. Okay, so I'm going to get final thoughts from you here in just a moment, but I want to go to our guest, Jenna. Jenna, thank you just so much for coming on and just sharing your story, your family, your daughter with us. We're just so glad Hazel's doing well. But just what's your final message to parents? What do you want us to know as, again, we're all sending our kids out there?
I mean, I think just to be informed, to know that it's going to be okay. But just trust your instincts, and like, was said before, your child the best. And if you want to be part of the solution, get tested if you think you need to. Keep them home the extra day, even though you don't have to. And so I just think it's really knowing what's best for your family, but then knowing how your choices can affect your neighborhood and beyond. It's really important right now to think critically and to just be empathetic and kind, and come to people from a place of understanding and wanting to move forward. Because, I told my husband, you catch more flies with honey than vinegar. And through a really nice conversation, a coworker of mine who wasn't vaccinated went and got vaccinated. And, I count that as a win. And if that's what this was all for, then it was worth it.
Well, we appreciate your voice of reason. We might have to have you back on too, just because. Just because you've just been great. We appreciate you just, like I said, kind of being calm through this process, and again, getting your little girl better. So thank you so much, Jenna. Mm-hmm. We'll be in touch, okay? And Dr. Myers, your final thought today. What do you got?
Somebody asked earlier about the efficacy of the vaccine in adolescents, and Dr. Hawkinson's right. It is really good. And the studies did look at preventing symptomatic disease, not just infection overall. The vaccines remain highly effective at preventing symptomatic disease, hospitalization, and death, to the point that if you are unvaccinated, you are 29 times higher to be hospitalized with COVID-19. 29 times as likely to be hospitalized with COVID-19 if you get infected compared to somebody who's vaccinated. You're more likely to die, you're more likely to die at a younger age, and you're less likely to be having underlying conditions that led to your severe infection and death, because we know that being vaccinated, even though it's not perfect, it prevents severe infection, it prevents death, even in people who are older and immune compromised.
We will see you sooner than later. Okay? Mm-hmm. Dr. Hawkinson, we have a whole week ahead of us. What do you want us to know?
We continue to promote vaccination, just for what Dr. Myers said. Continues to be really efficacious and very helpful in preventing hospitalization, severe disease, and death. They are safe. With any luck, we can start to see decrease in cases, and hence decrease in hospitalizations moving forward in our area. But it will continue to be important to get those unvaccinated populations vaccinated to help with that.
All right. Thank you all for being with us today. Tomorrow we have got 2 K-State University virology and wildlife specialists joining us. We know that COVID-19 can impact our loved ones, our parents, spouses, children. But what about your pets? We found out tomorrow what's going on with that. That's tomorrow at 8. But we leave you with this morning. This is a video. Our health system chaplain staff, they have a tough duty of spending final moments with patients and their families as they say their final goodbyes. It's made even worse when many of these people would not even be here in the hospital had they been vaccinated. So please let this sink in. Watch this.
Good morning, Stephanie. Is this a good time to come in and pray? I think it feels different because we've been to this place before, and that brief time of hope just seems like it's been swallowed up by what we're dealing with now. And it happens so fast and so furiously. God, please gather them in your arms. Part of the way I provide care for people when I'm at the bedside and someone's dying is having to pay a lot of attention to listening, and it's not just listening to the words, but being very aware of people's nonverbal communication too. The hardest part about being at the bedside when someone is so sick is that I know my job is not to fix things. The hardest part is that ability to be present in the midst of such heaviness and such grief and such sadness, knowing that there's no magic wand to wave to make this better. Maybe this would be a good time for me to go in and have a prayer at the bedside. I think what makes it even harder with COVID is that we do have some tools to fight back against this. And if people will make use of the vaccines and masking, we might not be there at the bedside. It hurts so badly when I hear people say that they feel like God is going to protect them. I really want people to know that there are ways that God may have provided for us through science, through vaccines. Science and faith can come together beautifully to help people. I don't know how you've been doing it day after day, and gosh, what's it been? 16, 18 months now. And faith means not just taking care of ourselves, but loving our neighbors. And if we can take care of our neighbors and not spread COVID, then to me that's an act of holiness.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.